Good morning, my name is Israel Jara. I'm from Universidad Católica Santiago Guayaquil, and I will be talking about polyhydramnios, transient antenatal Bartter syndrome, and MAGED2 mutations. Definition: Polyhydramnios is the excessive accumulation of amniotic fluid, the fluid that surrounds the baby in the uterus during pregnancy. Transient antenatal Bartter syndrome refers to an impermanent Bartter syndrome, a rare inherited defect in the thick ascending limb of the loop of Henle during pregnancy. Both of these pathologies can be caused by a mutation of the protein coding gene MAGED2 melanoma antigen family D2, and these mutations were seen mostly in male offsprings. It doesn't happen in females.
Polyhydramnios is a pregnancy complication in which there is too much amniotic fluid inside the womb. Amniotic fluid surrounds the fetus inside the womb and plays a critical role in the process of fetal gestation. It promotes fetal growth, insulates the womb from heat loss, and acts as a protective cushion around the baby. In a normal pregnancy, the amount of amniotic fluid should stay within a certain range. Polyhydramnios is a condition that occurs when the volume of amniotic fluid exceeds that certain level. Polyhydramnios is diagnosed in approximately 1% of all pregnancies, which makes it uncommon but not rare. Most cases of polyhydramnios are classified as mild and only involve a small amount of excess fluid. There are usually no symptoms associated with mild polyhydramnios. Moderate or serious cases usually do cause physical symptoms. The most common symptoms include swelling in the feet and ankles, short breath or difficulty breathing, heartburn, and abdominal discomfort. Serious cases of polyhydramnios can cause a number of risks and complications. The most significant complications associated with this condition include prematurity, fetal macrosomia, fetal malposition, and umbilical prolapse.
So now we talk about applications in medicine. The information collected from the investigation gives doctors additional information for possible causes for the diseases mentioned. Also, doctors can now be prepared to treat or to help the baby and the mother by detecting a mutation of the through a whole exome sequences of DNA. Now to talk about the pros and cons. Pros: the treatment will help the patient, their quality of life. The antenatal Bartter syndrome is transient, meaning it's temporary. Cons: the treatment doesn't include the solution of the gene mutation, and just male babies have the risk to develop these pathologies. Now we'll talk about the issue in Ecuador. In Ecuador, Polyhydramnios is found in controls done to pregnant women, and the MAGED2 mutation can be the cause of some of these cases. There isn't information about Bartter syndrome in Ecuador, it may give in to its rarity. Being a third world country, the care and treatment for cases that present this may not be the best.
Hey guys, welcome back to All in Law. This is OBGYN, that's obstetrics and gynecology. Today we're going to talk about what are the maternal complications due to polyhydramnios. Maternal complications due to polyhydramnios. So polyhydramnios is a more than what we call amniotic fluid, more than 2 liters is known as a polyhydramnios, and there are different criteria for that also. So we're going to discuss that in detail in what we call medical video lecture. This is for a quick revision for your USMLE or for any other medical board examination preparation. So we're going to talk very briefly. So what are the maternal complications due to polyhydramnios? So remember the most important being the preeclampsia. Okay, preeclampsia. Then it causes what you call a placental abruption. Placental abruption. This is due to what you call a rapid decompression of the uterus when membranes are ruptured. Okay. Then you have what you call cord prolapse. Okay. Then preterm labor. Postpartum hemorrhage, really very important. Okay. Then we have premature rupture of membranes. So these are the important complications due to polyhydramnios on mother. Maternal complications, that's a preeclampsia, placental abruption, cord prolapse, preterm labor, postpartum hemorrhage, and what you call PROM, that's a premature rupture of membranes. Okay guys, so try to memorize these complications. These are really very important. Thank you so much for watching this video. Take care.
And for conclusion, this recent information about the effect of the mutation of the MAGED2 gene is important to consider so doctors can give a good and complete diagnosis, and also give the best care during the pregnancy. As it is a gene mutation, there isn't a treatment for the MAGED2, but what can be treated is the polyhydramnios and the effect produced by the Bartter syndrome. Also, these diseases are normally dangerous or lethal. Thank you.